1470 WOCA.
Ocala.
All right, 5 minutes after 10 o'clock. It's a beautiful Thursday, isn't it? 71 degrees. Maybe the weatherman is right. Maybe. He said 75 would be the high today. I didn't think so, but now it dropped a degree in the last hour or so. We definitely have some cool temperatures moving in just for 3 days. A little reprieve. Yesterday was summertime, so we had early springtime again for the next 3 days, and then it'll be back to normal springtime by Sunday. If you are living with some kind of pain in your knee, in your joints, if you are living with a little more weight than you want to carry around, if you've got the diabetes scare going on, maybe you're close, or maybe you've been told that diabetes is, you got to be careful because you're borderline. Maybe you're just older and you've got a lot of things that are not so unusual for older folks. I hope you know that our next guest, Mark Shaw, who represents the offices of Dr. Juan Yordan down in the Villages, I hope you know that they are here, not somewhere far away, because I know if you listen to us all the time, you know that Robin and I speak to guests all over the world. But when there's a doctor, you don't want somebody all over the world. You want somebody nearby, and this is why I want to make sure I stress that before we introduce Mark. Mark Shaw is on the phone. He's been with us before. He is the case manager for Dr. Yordan, and he's a member of the Foundation for Wellness Professionals, and he comes on the air to answer your questions, which means you are definitely invited to call. The number is 622-9622. Good morning, Mark. Thank you for waiting through all that.
Good morning, Larry and Robin. How are you both today?
We're both pretty good. I've always had a question. Do I pronounce Dr. Yordan's name correctly, or is it Yordan?
No, it's Dr. Yordan. You're pronouncing it perfectly correct, yes.
Okay, I've heard it both ways, and I wanted to be sure. And by the way, and I know you know this, but Joe and Patsy from here at WOC are going through the knee treatment, right?
Mm-hmm. That's correct.
I don't know if I'm violating a privacy thing there, but
as long as they have no issue with it, meaning if they're the ones that told you, that's fine.
Yeah, and so they're getting the platelet-rich plasma treatments that you've been talking about.
Mm-hmm. That's correct, and getting fantastic results.
And I think that and the weight loss are the two things that get us the most calls. After you've been on, hopefully they're calling you, because that's what I always do, is direct them to you.
And like I said before, it's a wonderful thing that we're doing, meaning with you on the radio is literally helping people, so I invite people to call in. I'm going to have Charlie, who is our practitioner here in the office, who actually performs the procedures. I'm going to have him come on with us here in just a few minutes and have him be able to answer questions for everybody. He also runs shifts and works at Monroe Regional in the ER, so he's very familiar with pain. Charlie sees literally everything from gunshot wound to bad knees, bad back, all kinds of things. So Charlie is well versed in dealing with pain, so I'm going to have him on for you today for patients to ask questions. We might get a visit from Dr. Yordan as well at some point during the show, but Charlie is definitely going to be here to answer some questions, and I invite people to call in because it's real simple. If they call us, it's a free consultation. We don't charge anybody to come see us and discuss, hey, I've got this knee problem, back problem, anything. They're welcome in our office, and the girls up at the front, Desiree or April, will happily get them a free visit to come in and to see us and Charlie, the practitioner, to go over whatever's concerning them, whether it's weight, diabetes, knees, shoulders, back, anything.
And sometimes people are shy because of the monetary cost to it, because sometimes insurance will cover it, sometimes it won't, and they might have money, but they might not have money in their own pocket, but you have something special for that also.
We do, Robin, and we literally can put it in everyone's budget. Due to the Foundation for Wellness Professionals, we have over $60 million to lend out to our patients. No credit checks, no interest. If they have a health concern, that is what the Foundation is there for. We want to make sure that they're getting the procedures that they need, and we can literally put it in everyone's budget. Everyone. So if whether it's from I can afford, $25 a week or $10 a week or whatever it may be, I encourage you to call. Don't live in pain. Don't have these health scares that can potentially cost you thousands and thousands of dollars later when it can be handled and taken care of today. And that's the options that we have. Our first visit and first consultation is completely free. And then from there, whatever the costs may be, like I said before, we've put it in everyone's budget. I mean, 90% of our patient base here in the villages is on a fixed income.
Yeah.
Whether that's retirement or pensions and so on, disability. That's most of our patients that we have. So we can put it in anyone's budget. They just have to want to confront it and get this pain and get this thing handled.
I was going to ask you if you could scare us. I'm going to ask you to intentionally scare us about diabetes. What could happen if it went unchecked? And then maybe give us some hope about what you can do if you do have diabetes. Okay, so scaring you, and that's simply because you asked, Larry. I'm not a doomsday or anything like that with our patients to get them to do services or anything else. Where sometimes I wish they would, and sometimes scaring them is a good thing because it turns their life around. But what I would say to you, can I interject something? The reason I'm asking you to do this is I had a cousin who died from diabetes. And I didn't know you could die from diabetes. So
yes, sir.
That's why I'm asking.
It's a very serious illness that causes complications with many, many different, obviously puts more pressure on circulatory system and everything from a standpoint of if you can control your diabetes with your diet, your intake, and get your A1C, or the sugars, get those under control without having to do it through medication, you are way ahead of the game. I mean, way ahead of the game. Because a doctor is left with, meaning if you're going to keep your current lifestyle, which your sibling must have, the doctor's only option at that point is just to start a spiraling downward effect of increasing your medication, increasing it. Because the body becomes acclimated, and because, I'm sure you've talked with people who have been in pain for a long time, and taking a painkiller or a drug just doesn't cut it anymore, right? It's like, oh, well, it doesn't touch it, I'm still in pain. Well, that's because the body gets used to that. Mm-hmm. That's a synthetic and a chemical. And when the body gets used to those things, well, they're not as effective as when they were when you first started. And that's the danger with diabetes is, naturally in handling it through a weight loss program and getting your A1C under control, I've not even death, where patients have had limbs removed and fingers, and because certain things also get very, very painful, like neuropathy, and I mean extremely, extremely painful because it affects that nervous system so much. So scaring you, yes, it is life-threatening. Diabetes can kill you, and it kills a lot of people every year, and that's not an uncommon thing. So that's enough to scare me, I don't want to be on medication for the rest of my life. I don't want to take gabapentin and painkillers and everything else because my feet feel like they have hot nails being stuck through them, hot needles. So that's scary enough for me, as well as, dying and certainly taking years off of your life. So.
And I know that Larry's cousin was very young, so it's not a disease that will affect the retirees, the people over 70.
Yeah, it's not. It is indiscriminatory. I mean, it will come after, like I said, diabetes, and there's several types, and obviously you can become overweight and become a diabetic, which is that's scary in itself, meaning being overweight has consequences these days. It's not just, oh, well, I'm just overweight. No, you can become a diabetic, and that's scary.
Okay, Mark, we do have a phone call, so let's take that call.
Okay.
Good morning. Thank you for calling. You're on the air with Mark Shaw.
Yes, thank you. Do you have dietitians on your staff that can help people with their diet control for early diabetes?
Yes, we do, and we actually have, and it's not a dietitian. Just so that I can clear the air with you, dietitians are, whereas they are good, we go a step above that. We have an actual medical doctor, and all your dietitians, your medical doctors. Trust me, they went to school for a long time, and it's not a secret to them the biology or the weight loss aspect of it. So the medical doctors themselves are much more trained in regards to that. So our medical doctor, Dr. Yordan, oversees all of our cases, as well as Charlie Brooks, and you have an entire meal book that from lists of any types of foods, and all of these things are accessible and obtainable in your typical grocery store. Nothing is exotic in what it is that we do in our weight loss program. It's something that, we know that it has to be sustainable in order for you to do that, meaning going to another company and getting prepackaged meals and getting stuff sent to you, or drinking shakes or doing these kind of things. You're not going to do that for the rest of your life. You're going to break down, and it's not sustainable. Ours is designed around just going to the grocery store. You're going to go to the grocery store. You're going to eat meals, and that's what is sustainable, and that's what our dietary program is designed around. And our medical doctors, Dr. Yordan, that these are the people who have chosen these things and put these things into place for whether it's I have heart problems, or I have hypertension and high blood pressure, or like yourself, you're a pre-diabetic. On our weight loss program, one specific patient comes to mind whose diabetes was out of control, meaning he was an 11 A1C, which means that his diabetes is not under control, and it's even difficult for the doctors to handle that with medications. After 6 weeks roughly on our program, he had his regular checkups, and his A1C had dropped to a 6.1. And that is a dramatic change, meaning that the doctor could drastically reduce all of the diabetic medication that he was giving him, because you're actually a borderline diabetic at 6.1 anymore. At 7, they're basically saying you're a diabetic, so on your A1C. So it makes a dramatic difference, and yes, we can help you with whether it's pre-diabetic or any of those.
And when we hear that lifestyle changes can help us reverse diabetes, a lot of times we think we can do it ourselves, but I know from experience that guidance from a doctor is always better than thinking the internet or just reading is going to help you.
No, well, you have to know the difference between a billion-dollar industry of, wanting to make money, which is the diet industry, and which is take this magic pill or do this magical thing, and you're just going to lose weight. And that's not a reality. Yeah. And you have to look at it from that standpoint. Or do I want to go to a medical doctor whose first priority is my well-being and my health and keeping me alive longer than the actual money aspect of it, just selling diet plans? So that's how Dr. Yordan approaches everything, and basically looks at it and says, okay, you're a pre-diabetic, or you have hypertension and heart problems. Do you want to handle this with a lifestyle change and go through this program, or do you potentially want to spend thousands upon thousands of dollars in your future dealing with medications and the spiraling down of your health? Because it's not just what you would pay for medications, it's what you're going to pay for, potential treatments and surgeries and different things coming up. I mean, because that's what's on the path in front of you.
And just to combine that or couple that with what you do with the knee pain, the hip pain, maybe the ankle pain, I'm guessing the more weight you have, the more likely it is that the lower joints are affected by having to hold all that weight.
Of course. Absolutely, 100%. I mean, it's simple. I mean, take your automobile, and trucks and cars and everything else are rated for a certain amount of weight that they carry, right? A 1-ton truck or a half-ton. All of these pickups and these things that you see are rated. Well, you put too much on there, it's going to probably cause damage to the tires, the shocks, the suspension, all of these things that is the same in your body. We're all affected by gravity. So you add more weight to it, and it's going to degenerate the joint faster, and it's going to wear it down faster.
Dr. Yordan's office is down in the Villages. I want you to know that. I'm just repeating what I said earlier. If you're just tuning in, the reason I think this is an important part of this interview is because, as I mentioned earlier, Robin and I speak to doctors and authors all over the world, and a lot of times they've got great information, especially if they offer services, but in most cases they're kind of hard to get to because they're in Philadelphia or wherever. In this case, it's in the Villages. Dr. Yordan is down in the Villages, and Mark Shaw is on the phone. If you have a question about any medical issue that you've got going on, we invite you to call. The number is 622-9622, and obviously the call is free, but so is your visit to Dr. Yordan's office, and I'll ask Mark to explain how that works on the other side of the break. Let's just take a quick break. It's about 1.5 minutes long, and we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. A front is going to be moving through with some showers and thunderstorms this morning. Then clouds will give way to some sunshine. It'll be breezy and cooler with lowering humidity some. The high 75 to 85. And then a clear, cooler night with a low of 47 to 55. Sunny with a breeze tomorrow, high 71 to 75. Sunshine, comfortable Saturday, high 70 to 75. From the Florida Weather Center, I'm Maggie Johnson.
Get it for less at the DIY Home Center outlet. Get top quality real wood cabinets the same or less than the big box stores are selling the cheap stuff. And that's not all. Drywall screws big box stores are $6.47 a pound. At DIY, only $4.99. Plus, DIY has the largest selection of mobile home parts and accessories anywhere. From carpet to doors, get the DIY supplies you need for less. The DIY Home Center outlet. We are your building material closeout store. 2191 Northwest 10th Street, just 2 miles east of I-75.
All right, let's see, 22 minutes after 10 o'clock. Mark Shaw is on the phone down in the Villages at Dr. Juan Yordan's office. And, Mark, we do have a phone call. Let's take that call. Good morning, you're on the air.
Okay.
Good morning, you're on the air. Okay, well, they left. If you were calling in just now, call back. Oh, here we go. Good morning, you're on the air.
Hello, this is Ann. I wanted to ask the doctor, do you do anything for people that have Parkinson's?
I'm sure that, yes, Dr. Yordan can help treat with Parkinson's. He deals with, as we said, we're here in the Villages, and I'd say 95% of our patient base is retired and over 70. So that would be in his realm, what he would treat and see you for with Parkinson's. Nutrition can certainly help, and your diet can certainly help in certain areas, but it's not going to be as dramatic of an effect on your Parkinson's as, say, if it was on a diabetic patient or a patient with heart disease or hypertension, high blood pressure. These are the main effects of what our weight loss and what our pain programs are for. Now, if you're having or experiencing neuropathy or pain in your legs and joints and everything from the Parkinson's, yes, it's a free consultation where we can have you come in and you can see Dr. Yordan and Charlie, and they will determine your case. Now, obviously, I can't tell you 100%, yes, I can help you over the telephone until we actually see you and the doctors examine you. And that's why our first consultation is free, is because we don't want to waste your time, your money, or your efforts to get to us. You schedule the appointment, we'll see you, and if we can't help you, we will do the work and we will direct you to the correct doctor who can.
And did you have a follow-up question?
No, not really. It's just I've got this tremor that's really bad. I mean, I can't, I'm just shaking all the time.
Okay. Let me announce the phone number so you can call down to Dr. Yordan's office, okay? I'm gonna disconnect you, okay?
Okay, well, just a minute. I want to write it down.
All right, thank you, Ann. I don't know if she can hear me on the phone or the radio. I don't want to announce it if she's not going to hear it. Okay. Ann, you there?
Yeah, I'm here.
Okay, the number is 352 633.
Just a minute.
Okay.
I have a hard time writing.
Okay. Oh, she's got the echo thing going on there. All right. Ann, can you hear me?
Yes,
633. Yes, 633-0473.
0473. Okay.
Got it? Okay.
I got it, I think.
Thank you, and call us, please, if you need that repeated, and that goes for everybody.
Absolutely. And Larry, we also have Dr. Yordan here if we'd have time to take another caller. I don't know if we do, but
Okay. We do. We have about 4 minutes, plenty of time, 4.5 minutes.
all right. Great,
Yes.
fantastic. So I'm going to let you talk to Dr. Yordan, and you can ask him some questions. And any of the patients, whether it's high blood pressure, diabetes, pain, weight loss, neuropathy, all of those things, Dr. Yordan is here, and he's going to answer your questions. Okay?
All right. Thank you, Mark. Thank you so much.
Here you go.
Good morning, Dr. Yordan.
Hey, Larry, how you doing?
Good. Gosh, good to have you on the phone. We don't ever have this honor.
Well, I try to make it sometimes, but sometimes it's difficult.
Well, rather than me ask you a question, let me take a phone call. If I see a few people were calling and then you dropped off, if you want to call back, I'll connect you with Dr. Yordan. You can ask a question. The number is 622-9622. And by the way, the number down at Dr. Yordan's office, just to repeat, is 352-633-0473. Okay, we do have somebody on the line. Doctor, good morning. You're on with Dr. Yordan.
Yes, good morning, doctor. Do you need a referral from your present doctor to be accepted at your clinic, and would you need like your medical history to be sent there?
Okay, that's a great question, and I'm glad that you asked that question. No, actually, for the PRP program or the weight loss program, all that, no, you don't need a referral from your regular doctor to come and check that out. Once you come, you can just call and make an appointment. Again, the initial visit is the consult is free of cost. We don't charge for that. We will take a full history at that point to see your medical conditions and everything before we let at that point we'll let you know if you qualify for a PRP, because there's some things that will not let you qualify for it, but if you do, we'll definitely let you know at that point. So to answer your question, no referral is needed.
All right, thank you for the call.
Do you have Saturday hours?
No, sir. We're here on the week only. We don't have Saturday hours.
Thank you.
All right, thank you.
All right.
And the number down there again for Dr. Yordan is 352-633-0473. And when you say PRP, I know that you know what that is right away, but for the listeners, that means what?
Well, PRP is a program that we're doing for the joints, and we're going to start doing some other things pretty soon as well. It's to improve joints in the sense of arthritic changes, any pain associated with it. It's a plasma treatment that we do, and that's something that definitely we'll individualize with any patient that comes, and we'll explain more in detail at that point. And
you mentioned the word asthma, not asthma. What'd you say?
Plasma.
Yeah, plasma. What was arthritis? Arthritis. Can it help arthritis?
Yes.
Okay.
Yes, that's definitely have shown a great improvement with arthritic changes.
And it's similar to, and in fact, Joe and Patsy are having this done with their knees. Hopefully, they're okay with me saying that.
But what? I'm sorry.
But that's what they're having done, right? Is the PRP in their knees? And Joe is having done, right?
Mm-hmm.
Yeah, and so we're looking forward to that. It's how long of a process is that? How long does it take to see the results?
Well, normally, right now we're doing a three-step, 3-injection series most of the time, and normally they start seeing results in about 2 weeks, and then, of course, as the injections go along, it just gets better. We are thinking of bringing a new system that will only take one shot, but that's still in the works. For now, it's a 3-shot three-shot series. And normally about 2 weeks into it, you start noticing improvement.
Dr. Yordan, thank you for coming on the phone with us today. For the listeners, I know radio shows go quick, but you can sit in Dr. Yordan's office and talk directly to him and have him answer your specific questions. The number 352-633-0473. Dr. Yordan And Mark Shaw, thank you both for being on the air with us today.
All right, Larry, you take care. I'm glad to be here.
Thank you. We'll be right back.
Alert. I'm Lillian Wu. Breaking news on an investigation into Russian interference in our election. The House Permanent Select Committee on Intelligence Chairman Devin Nunes has just announced he'll be stepping aside as far as that investigation is concerned.